Okay. Welcome back to Coffee Talk number 5. I am Dr. Angie with Synergy Chiropractic and Sports Rehab.
I'm Dr. Mary Helen Gustafson, owner of Nurturing Wellness, Physical Therapy, Orthopedic, and Pelvic Health.
Your voice is just so kind.
I was born with it.
I am not born with this voice. I've been sick. So if I randomly start coughing, I'm sorry.
I'll take over.
Yeah, just don't make me laugh.
But before we go further, we have to talk about how good your hair looks today.
Shout out to Ashley Vieira. If one day she ever watches this.
Very good.
I did somehow manage to get my hair done this weekend. Sick, so.
Amazing.
Thank you so much. I hope to come back looking like this with every episode.
Yeah.
We try and look somewhat decent, and then we laugh. We walk in, we're like, oh, we need to change.
Yeah, I just came from working out, so it did a quick change. I do not have amazing hair today, but it's because I was lifting weights.
We're fine.
Yes.
We'll trade off each day.
Yeah.
Trying to live a healthy lifestyle. Speaking of healthy lifestyle, I think the topic today is you describe it.
Sure.
You said it
really
well
I was
earlier.
saying, why don't we start to actually take a step back and talk about maybe it's not all perimenopause or menopause or hormones. Let's also just highlight how important these healthy habits are, no matter the stage. You know, I think about, for women's health specifically, we can talk about men here too, but highlighting the importance of talking and educating, starting with menstruation, through however old you might be, who's listening, like 70s, 80s. I'm not kidding. That it doesn't matter how far we go with talking about lifespan, and the habits that we develop, and also give us grace to shift habits, because what we have the bandwidth for in our teens and 20s, life gets different in our late 20s and 30s
of life.
Seasons.
Yeah.
But maybe with all of, like anything, now the media and health and wellness in a good way, we've started to prioritize women in a small steps and highlight menopause and perimenopause. But with that pendulum swing, we can always get too extreme. Yeah. And I think then we don't want to always just be pointing the finger at hormones.
Yeah, absolutely.
And you said this when I was talking to you about it, that, yeah, the whole thing is that regardless of how yes, hormones are going to change. That's part of being a woman. Maybe our symptoms will be less if we have these healthy habits established. So we won't feel all of these wild and crazy symptoms of menopause as severely.
Too much fluctuation. It's like, how can we level you out to feel the most minimum of symptoms?
Yes.
Because I just, in general, it doesn't have to be that extreme. Let's dive in. Do you want to start at younger age real quick and kind of talk about like having your period and everything, and like what even your experience a little bit, and even mine recently, like diving into that.
Yeah. So I think a thing I hear, I touched my microphone. The thing I hear a lot in here when I'm talking to people coming in for whatever their symptoms are, like, you should have known this when you were 14, 15.
Yeah.
And now, only because it's become a problem, are we talking about it?
Yeah. So more reactive than proactive, because that's what unfortunately, our healthcare system is, and society is. And
so right off the bat, thinking off the cuff here. So so when an adolescent starts menstruating, periods should not keep you out of school. They cramping in a small way is normal. Heavy cramping is not normal. Needing to take Advil or pain meds, not normal. Bleeding through your pad, more than, say, if it's multiple, I forget, there's a real medical, if I had prepped for adolescence, I'd give you the actual statistic, but the heavy clotting bleeding, not every normal. Period, every day is not normal.
Not normal at all.
Because then you have to think about all the deficiencies that come with that.
So you know what's funny, real quick, not to interrupt you, but I remember I'd go to the OB, gyno, and be like, they're like, do you have clotting with your period? I remember I'd be like, yes. And then they don't say anything. Like, that's it.
Yeah, so they do their due diligence.
So they made me think like that's normal.
Yeah,
right? And it's just like letting me know like the
And
like,
you're not going to ask as a 16-year-old. You're not going to say anything.
In my 20s.
Yeah.
They ask those things still. And I'm like, if you're not on birth control, so they're going to. And so I like, that's what I said. And nothing. Yeah. And then when I find out later, like I read the period repair manual or like even working with my naturopath of understanding like more clotting means like too much estrogen and too much hormone fluctuation, whatever it may be for your body.
Yes.
So sorry to interrupt, but like that's the problem is that a lot of things are too normalized when in actuality these are signs that you need a better life balance because your period is almost like your check engine light.
Yeah, our fifth vital sign.
Yeah.
And then on the flip side, those kiddos who don't have a regular period, yes, there's a ramp up phase when you first start menstruating. It might not be regular. But after a few months, if we're not seeing typical cycling and a lot of missed periods, then we're really looking into, is there a deficiency in nutrition, over exercising? That's a big marker as well.
Is that the triad?
Yep, the unhealthy triad. Yep. And so people, again, just like your experience, they might see that, but then are they following up? Like, are your medical professionals getting on you, getting on your parents about this? Probably not, because those are the uncomfortable conversations.
Very, yeah.
But if you're listening and you're a parent of a teen or 20-year-old, it's good
to have these conversations.
Or even a 6-year-old, so you're ready to have these conversations.
There's some girls at like 8 years old getting their periods.
So now this is on my list to research what's happening, but puberty's happening younger.
Oh God,
across the board.
I couldn't even imagine.
And there's probably lots of reasons why.
Yeah, it's just we could go down a rabbit hole.
So too much for this.
Yeah.
And then also when you're learning about periods and sexual health, I think we should also learn about healthy habits with peeing and pooping. I've recently had a teenage athlete come through and coming in with back pain, and I had to really just get to the nitty-gritty of a lot of kids, if they're in school from 7 a.m. through sports practice, or maybe they, especially in the winter here, like if you're a swimmer, you might not get pool time till 7 or 8 p.m. So there's an in-between where you're at school studying. Let's be real. People don't want to have a bowel movement unless they're at home in their private space.
Oh my God, that's so true.
Up at the alarm clock, eating a granola bar on the way to school, and then boom, 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 you're not home till 9
You're going to want to hold that.
Yes.
I did. There was no way I was doing that at school.
So these are conversations. I would love to see more teens come through here. Obviously, pelvic health is not top. People aren't coming to pelvic floor PT as a 16-year-old readily, but I do see patients that age sometimes. And it's really important to learn these things. So how to have healthy bowel movements. I get deep dive into that. Peeing. Not hovering over a toilet seat. This can wreak havoc on your pelvic floor. Knowing how often to go, not going just in case. All these tips and tricks I teach people when they come in because they have problems.
You should have known this teenage years.
Yes. And then when I'm speaking to my patients now who might be parents, I'm like, so just so you know, when you're potty training your kiddos, these are things to consider.
Absolutely.
And it's not something I don't want to overstep and be like, this is how you should potty train. But I'm like, hey, this is my chance to then prevent a little bit.
Absolutely.
For those people. So that's menstruation, I guess, 20s.
Yeah.
Did I skip over anything? Teens?
No, I think that's a good summary, like a roundabout of like.
Yeah. And then merging into 20s. So a lot of people don't realize in the female population that having penetrative intercourse shouldn't be painful. That's a huge thing that comes up in here with me, and people don't talk about it per se, but it shouldn't be. And
would you say if they had painful intercourse at a young age, could that change the entire trajectory of like almost like their entire life? Yeah.
Yeah, they just internalize it, think it's normal. they might feel alone. So then any negative emotions you have as a woman, that creates pelvic floor tension. Not thinking that, like a speculum exam or an exam with your gynecologist also shouldn't be painful, depending on the procedure. Yes, but I'm talking general, not doing biopsies or IUDs. I'm talking about general pelvic exam. It shouldn't be painful.
Yeah.
So one, if you're listening and it is, tell your provider that they can talk you through it and change the setup, figure out something that can help you in the moment. Don't just suck it up, because the way pain science works, so this goes for intimacy or pelvic exams or pain, anything that creates pain for you. If it's painful once, your body's healthy and smart, and it will grip and it will try to protect you when you're going through that moment again. And so that will create more pain. It's
like muscle memory.
Exactly. And so we have a pain feedback loop. It's our brain saying, whoa, even if you think you're trying to relax, you're smarter.
Yeah.
And so it's not a no pain, no gain. You shouldn't push through it and just keep having painful intimacy or painful exams.
Absolutely.
They will get more painful.
Yeah.
Or continue to be as painful. So there's a lot we can do to unpack the why in pelvic PT and working with you and getting your hips moving. And there's a lot. It depends.
There's so much
on the why.
Yeah. What's good with Mary Helen is that she can, because internal exam and just talking, you're specifically talking about just pelvic floor. You get really deep with people.
Yeah.
And like there is a very big emotional component that happens with pelvic floor therapy. And like she's trained to handle that too.
Yes.
So that's just interesting of like, hey, like any moms listening, you have older daughters that are maybe teenage and 20s, like encourage to go see if you have heard some symptoms, but like, you know, you haven't really gotten to that conversation, like encourage like, hey, why don't you go see someone like Dr. Mary Helen to like, let's just do a checkup even. And then maybe that can uncover things and understand like, hey, then you can move forward and see like, okay, maybe they need more internal work, just so she can learn to connect with her body more, because it's a connection.
Yes.
And a lot of times I feel like girls in their early 20s, like they think like kind of connecting to it and understanding what's happening down there is through sex. And it doesn't have to be that way. I think hopefully we're shifting a society to talk about these things a little bit more.
Be more educated about your own body.
Yeah.
For yourself.
And like, so definitely like if you can't encourage, like things need to change a little bit, because then that's going to set her up for, now we're going into our 30s, right? So I guess I'll transition a little bit here too of like my own journey with pelvic floor and like periods and everything, right? So I fortunately, like I have gone to Mary Helen, like I've had long-standing back pain. I can get into that one day, but not a direct correlation. Like maybe there was painful intercourse at one point, but like we can kind of pinpoint why and everything. And for me, my biggest thing is the education I didn't get before was periods. And I've had painful periods my whole life until I started working with my naturopath and we started doing specific seed cycling, talking about hormones, eating certain things. And like just this January was the first time I didn't have to take Advil.
That's so.
I used to have to pop 15 Advil, 15 within less than 48 hours to just like, I used to get extreme bloating, cramps that like it'd wake me up in the middle of the night and I'm just sitting there like rocking back and forth. And it's just like, I can't lose sleep over this.
You can't miss work.
I'm hands-on. I walk around all day. Like I can't miss work. Like I can't sit here with a heating pad and talk to people. It's not what I do on my computer. So it's like, hey, do what I gotta do. Pop it. Obviously I feel so much better and so good. It's like, you can't.
I know we have lawn.
Of course they're doing the lawn right now. Should know better. So, you know, like you have those circumstances that a lot of people go through. And I'm just like, when I hear women that are suffering through a period, I was like, can you please like go to someone that's different and like talk about seed cycling, talk about these things, because like I knew it wasn't supposed to be that way. It just kind of took me some time to like really, you know,
there was an inflammatory situation happening in our food. So thinking about the
sugar intake.
So if you're a teen and living at home and maybe there's more likelihood that you have a healthier eating, but not always, depending on the house you grew up in. But then if you're someone that had periods like Angela and then you go away to live in college, that is like a whole other level of inflammation, depending on,
absolutely,
there could be the rare unicorn that focuses on health and wellness in college, but a lot of undergrad kids, that's when we're seeing unhealthy eating, crazy sleep habits. If you're an athlete, you're really pushing your body. If you're choosing a different route, again, sleepless nights with studying or just over committing, or also getting into just, you know, a little more party scene, that's going to inflame your body.
Absolutely.
So your periods are only going to get worse.
So I guess this is how we can transition this. So like all this being said, like see how lifestyle can affect your period. So your period is your check engine light, right? So like
just like blood pressure, just like heart rate. What other tests do we do? Labs.
Everything.
Your period should be
What's
up there.
cool is like with women, we get it monthly check. We don't have to go and get blood work every month. We literally have our period tell us. Now, if you've had abnormal periods, or this sounds very similar to you, and now we're going into menopause, perimenopause, this is where it can start getting tricky of just like your body has been telling you, your lifestyle has not been there, and it has not supported your body. So even if you're like, so I'm the type that like I'm a 28-day cycler. I'm rarely like, and that's why I thought like I'm healthy, like this is normal. Okay. So like even if you've had that, but you've had this extreme pain also, like what I've had, guess what? Like this is my time right now that like I'm trying to be so like less inflamed in my body and really focusing on my health, because
as your life gets busy,
as my life also gets busy, like I've had these past couple of years are crazy, like owning a business and like, you know, things happen in your personal life and then like things just don't go your way. So all that to say is like really focusing and honing on my health. I'm 32. So hey, 35, like going into perimenopause. If I do this right now, like I'm not trying to make up for the last 20 years, but like I'm trying to do something here. But if I can shift this, if I shift everything, like I know I could have a more comfortable perimenopausal, menopausal situation in my life.
You don't have to wait for shit to hit the fan.
No, and that's I think that's what we're and like menopause and like we're labeling these symptoms as menopause. Absolutely. It is like the shifting of hormones, but we can have a less dramatic experience that I feel like it's not talked about enough, is changing of your lifestyle and just your health hygiene.
Listening to the whispers that your body's telling you along the way and not ignoring them.
And like the period was one, right? Like that's what I'm trying to say. Like you've had this 20 years of like, hey, letting you know we got to change something here because you're about to go through some crazy extremes, you know?
And now I forgot what I was going to say about that.
Sorry.
No, don't be sorry. The whispers, and then
like we shouldn't have to, granted we don't prescribe hormones, but like, and we think that hormone replacement is very important for women during this time, but we also it shouldn't also be a cop-out. We should be looking at every part of your
that
lifestyle.
That alone is, again, just one
component
of being healthy.
One component of being healthy.
It's just like those people who might come to us and say maybe they just need surgery, and maybe you do. And now I remember what I was going to say. But if you are someone that's a surgical candidate, you still also have to change some things to optimize that surgery. So just to optimize hormone therapy, we still need to unpack layers of your lifestyle. I remembered what I was going to say, and it was to just also recognize lifestyle and improving your wellness cannot alone treat real diagnoses like endometriosis or other things that are real factors for why you have painful periods and heavy bleeding and debilitating symptoms. So I don't want to minimize.
When people get to that extreme, like, we don't want to minimize that. And like when people get to that extreme, like you're kind of in the doctor's office really early on in life when
what's hard is it takes 7. So I just got off the phone with someone last week. She was so upset, calling from work on her lunch break in the car. And I have a current patient who the same thing, over 20 years to be diagnosed with endometriosis.
Oh, yeah.
So
they know their symptoms early. Like
they know.
Yeah.
And no one's
But
listening.
No one does it. Yeah, we could literally have a whole
So that's a whole other thing.
But
just if
do
you
a whole
were
segment on
listening,
endometriosis?
yeah, I think just part of me got this empathy of, if you're listening right now and you have endo and you're like, no, like if you're angry with us for saying,
yeah, sorry,
I just was wanting to
trust
recognize.
me, we absolutely understand endo and like what that is, and
just
that's a whole
today,
different.
We're focusing on lifestyle and the importance of it.
Absolutely.
And for the endo warriors, you guys are
we feel
lifestyling a lot.
That's a whole different category.
Yes. But I think we've said what we wanted to. I know we started with menstruation, 20s, 30s, and just how life gets harder and harder with our stress of work or family or personal.
It's kind of like that critical decade that, like, remember we talked about, like, episode 1, where it's like, hey, 35 to 45, a lot of changes are happening, but, like, can we optimize our health?
Because biologically, we are aging. Like, our bones are aging.
Yeah.
We just are starting to see breakdown, and that's just going to happen. We can be as healthy as we want, but we are aging.
Mm-hmm.
We do have a time limit on our time here, so we have an expiration date.
Everyone does.
So we just want to always highlight, we know it's hard, and
we have our own journeys.
That's why we do what we do. And we highlight the importance of listening and pivoting in treatments, if symptoms are different or if something's going on in your life. You didn't get sleep, you have high stress, we're not going to be, squatting your heaviest squat or, we take a step back. And I think just the importance of the inner knowing that you know your body and that your symptoms matter. And even at 12, 13, 14, 15, when things are happening, I think as parents, it's on us to just create a happy dialogue there. And then I'm navigating this myself. I don't know how to do it yet. And then,
that's right. You have a little girl.
And then, and even with the guys, just talking about puberty is a whole thing. And then in your 20s, again, periods should not be something that gets in the way of your life at all.
Yeah. And we want to just help, if you feel like you're not able to express this to other providers, or like you don't have the time, that's why we take the time to listen to your story. Because if we need to help you to whatever, if it's like help lifestyle changes, or like, hey, this is who you should go see, or hey, next time you go in, I need you to highlight X, Y, and Z. Like, we're here to help you with that. Because we can recognize these things. Like, we have, we've had the coach, we have the education, to know when it's like, hey, hold on, we're going to touch on this real quick, and then this is what I need you to do for steps.
All right.
Okay. So talk a lot about periods.
Yes.
That's cool.
All right. Your voice hung in there.
It did. I barely coughed, which is nice. I gotta get more tea. But okay, thank you guys for joining. I hope you
do the hair toss.
Hope you live a healthy lifestyle.
Till next time.
Yeah, baby.